Hi everyone, this is Dr. Mamta Java and here I am presenting to you the second question of the series Case Files in Clinical Microbiology, and here is the question. A critically ill patient who has Foley's catheter develops a serious UTI. The organism is identified as a motile, non-urease producing, gram-negative enteric bacillus with a high degree of antibiotic resistance that rarely causes disease in immunocompetent people. The agent formed pigments on nutrient agar cultivated at room temperature as shown in the photograph. What is the etiology of this patient's UTI? So this is the photograph and your options are Escherichia coli, Klebsiella pneumoniae, Staphylococcus aureus, and Serratia marcescens. Now, guys, just by the knowledge of basic microbiology, you can easily rule out at least some of the options. For instance, the question says it's a motile organism. Now, let us see which of these organisms is motile. Escherichia coli, yes, it is motile. Klebsiella pneumoniae, no, it's non-motile. Staph aureus is non-motile, and Serratia marcescens is motile. So, just by the sheer knowledge of motile and non-motile organisms, you can easily rule out 2 out of the 4 options. So we are left with Escherichia coli and Serratia marcescens. Now, the organism in this particular patient shows pigments on nutrient agar as seen in this picture, and as you can clearly see, it's a red colored pigment which is confined to the colonies only. It has not diffused into the medium. So it's a red colored non-diffusible pigment, which is a characteristic feature of what? Not Escherichia coli, but Serratia marcescens. And Serratia marcescens is a non-urease producing organism, just like Escherichia coli. But it is the only organism amongst all these 4 types which is associated with red colored pigment production. So the answer in this case is Serratia marcescens. Now, guys, I want you all to remember some important, points regarding Serratia marcescens, and one very important point you can simply decipher out of its species name, that is Mars. Now, I have highlighted M, A, R, and S in red color. You know why? The reason is this. Mars, the red planet. Alright, so we have an organism in microbiology, that is Serratia marcescens. It has got Mars in its name, and Mars is known as the red planet, which keeps revolving, revolving around the sun. So remember, just like Mars, the red planet, we have got Serratia marcescens producing the red pigment whose name is protegeosin, and just like Mars moves around the sun, we have got this organism also as a motile organism. So 2 simple points you can simply remember from this. And then what else you need to remember about Serratia marcescens? The red colored pigment which is produced, that is protegeosin, its production is enhanced at room temperature, that is 24 to 30 degrees Celsius. And that's what our question also mentioned. If we go back to the question for a moment, the agent formed pigments on nutrient agar cultivated at room temperature. The penultimate line in this question. So this is a very, very important clue. Pigment production, remember, is enhanced at room temperature. Alright. And pigment was produced on nutrient agar, and telling you that it's a non-fastidious or a non-fussy organism. Alright, it belongs to the family Enterobacteriaceae. Remember, it's a family of gram-negative organisms which are non-fastidious or non-fussy, meaning they're going to grow nicely on simple or basal culture media like nutrient agar. So this is about the pigment. And the other thing is, remember, Serratia marcescens is the most important species. It is otherwise very innocent, it's a saprophyte. Remember, S for Serratia, S for saprophyte. So it's otherwise innocent. It is going to disturb or, make life difficult for only those people whose immunity is less. So it is notorious for causing, symptomatic disease in immunocompromised individuals. And that in turn was another clue in our question, that the organism in this patient rarely causes disease in immunocompetent individuals. And amongst all the infections Serratia marcescens causes, remember 2 most important ones are urinary tract infection, which our patient was suffering in this question, and the other one is pneumonia. And it in such patients with pneumonia, it colors the sputum red in color because of the pigment proteoglycin, and that is referred to as pseudohemoptysis. So guys, the sputum is red in color not because of blood but because of the red colored pigment, hence the term pseudohemoptysis. It's a saprophyte, already I've told you, and it is notorious for causing infections in hospitalized individuals, that is nosocomial infections. It can cause a plethora of infections like meningitis, endocarditis, so CNS involvement, serious involvement, very severe infection like septicemia, urinary, respiratory, and wound infections. But out of all these different types of infections, the two most commonly infections which clinicians see in their practice are the urinary tract infection and pneumonia. Now, the other important fact about its pigment is the hospital strains. Remember, it's mostly going to cause infection in hospitalized individuals, but these strains isolated from these patients who are hospitalized, they are often found to be non-pigmented and unfortunately multi-drug resistant because of the production of AMC beta lactamase enzymes. And as far as biochemical properties are concerned, we usually don't make use of these properties in the lab, but in MCQs they can sometimes ask you. Just remember three important enzymes it produces: lipase, gelatinase, and DNase. Now, as I already said, unfortunately, most of the organisms, most of the isolates are multi-drug resistant, that is MDR, and you have to rely, of course, on the antibiotic susceptibility test, which the microbiology lab is going to give you to manage your patient. And do keep in mind that this organism shows intrinsic resistance to polymyxins and nitrofurantoin. Now, this is a very important point because nitrofurantoin is a very common drug for UTI, so you cannot go for nitrofurantoin in case of those patients who are suffering from UTI because of this organism. So that's all for this video, guys. Do let me know in the comment section if you have any topic in mind which you want me to make video on, and I'm eagerly looking forward to your comments on this video. If you like the video, please hit the like button, subscribe to the channel, and share the video. Thank you.